everyone. Welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Kimani Hendricks, the Multimedia Communications Coordinator for MS Focus, and today, Dr. Herb Karpatkin will be answering your MS-related and physical therapy-related questions for the next hour. Before I introduce Dr. Karpatkin, I would like to address those who may have some questions already. If you don't want to wait for me to finish talking, I'll tell you how to ask them. So if you are watching from Facebook Live, you can type your question into the comment section of the stream. If you're on Zoom, utilize the Q&A and chat box features below. If you would like to speak directly to Dr. Karpatkin, you can raise your hand by pressing the icon at the bottom of your screen if you are on a computer. But for those on mobile devices, press *9 to raise your hand and then wait until we ask you to unmute. Herb Karpatkin received his master's degree in physical therapy from Boston University and a doctorate of neurology from Rocky Mountain University. He is board certified in neurology and geriatrics clinical through the American Physical Therapy Association and is certified MS clinical specialist through the Consortium of Multiple Sclerosis Centers. He has held clinical posts at the Rusk Institute of Rehabilitation Medicine, Burke Rehabilitation Hospital, the International MS Management Practice, and academic posts in the physical therapy departments of Touro College and Hunter College. He has presented extensively both nationally and internationally on physical therapy and multiple sclerosis, and has published articles on MS in the Journal of Neurologic Physical Therapy, Archives of Physical Medicine and Rehabilitation, International Journal of MS and Multiple Sclerosis International. He is the recipient of the 2015 American Physical Therapy Association Award for Excellence in Neurologic Education and the 2019 National MS Society Research Partners Award. In addition to continuing to be actively involved in patient care, he is a tenured associate professor of physical therapy at Hunter College, City University of New York, teaching courses in neurologic evaluation and intervention, psychosocial aspect of healthcare, and research design. We are pleased to have him join us to answer these questions for you guys. And Dr. Karpatkin, thank you for being with us. I will turn it over to you for further introduction and also to catch my breath, if that's okay.
Thank you very much, Kimani. Very grateful to the MS Foundation for giving me this opportunity to speak with MS patients. I've been working in MS, as you could hear from that introduction, since the 1990s, and I am very convinced that most persons with MS don't take appropriate advantage of all that physical therapy can do to help them. And so I take every opportunity that I can to try to teach people with MS about what physical therapy can do. So I've already see there might be one or two questions. So what we're going to do today is I'm just going to take questions and I will try my best to answer them. And as I've said in other talks, if you want to get in touch with me afterwards, you can do so through the MSF. I can give Imani my contact information. I have no trouble at all with people reaching out to me directly. So let's go ahead with the questions.
Sure. So right now I've got a question from Elizabeth. She asks, how do you increase walking endurance given inevitable muscle fatigue?
That is, you're starting off with one of my favorite questions ever, because this is a big topic of my research. And to answer the question, you have to understand, why does fatigue happen in MS? And the reason for that, in most cases, not in all cases, but in most cases, it's because the body overheats. Most of you, if not all of you, know that heat is the enemy of people with MS. And one of the reasons it is when your body gets warmer, conduction through demyelinated nerves gets slower and slower. So, and the problem with walking and with exercise is the longer you exercise, the longer you walk, the warmer your body gets. Therefore, you got to find a way to keep yourself cool when you walk. So there's really two primary ways of doing that, which I tell my patients about. One is relatively simple. you keep yourself cool by wearing some type of cooling garment. And I bring this up as a shameless plug for the MSF because I know they have a program for getting free cooling vests to people with MS, and I urge people to take advantage of that. You can also make sure that when you're walking, you keep your body cool by either not wearing too many clothes, by by having a cool drink before you go, by cooling off before you head out. But the other way, and this is something that I do with all my patients, is something called intermittent training. So consider the following paradigm. Say we take two identical people with MS, and one, we just ask them to walk as far as they can without stopping. The other one, we say, walk for a minute, then rest for a minute. Walk for a minute, rest for a minute, and keep going until you can't go anymore. The person who takes rests will walk much further. And we call this intermittent training. It's something I've been studying at Hunter and having my patients do since the early 2000s. It's extremely effective, and I can give you numerous success stories for it. But the problem that it addresses is it keeps your body from heating up. Most people with MS, they'll say, well, I'm going to walk and I'm just going to go as far as I can until I can't go any farther. And that's a mistake. What you need to do is actually go, and then as soon as you feel yourself starting to get a little bit tired, stop and take a break for 60 seconds, 2 minutes, then go again. And go walk until again you feel a little bit of fatigue, stop, recover, then go again. And what my patients have found, not only can they walk further by doing this, but it gets a better training effect because they're doing a greater volume or greater dosage of training every time. So all of my patients, all of my MS patients who have this endurance problem, and that's pretty much all of them, I have them do some type of intermittent training. Rather than going as long as they can without stopping, I have them walk, rest, walk, rest, walk, rest. The more you rest, the longer you can walk.
The next question is also from Elizabeth. She wants to know how to transfer indoor physical activity to outdoors, if you can help her on that.
Transfer indoor activities to outdoor. Elizabeth?
I'm guessing, yeah, I'm assuming that she wants to, that she maybe does more active stuff inside and wants to know if there is some sort of transition that she can do, something to help her transition better. Elizabeth, if I'm totally butchering your question, please.
Yeah, Elizabeth, clarify this for us a little bit. Clarify this for us a little bit.
Okay, so I'll go to Nancy next. She asks, how many miles should she walk?
The answer to that question is it depends on so many factors. Instead of thinking of miles, though, think about time rather than distance. Think about the amount of time you spend walking. What I do with many of my new patients is I have them do what is called a collapse point walk, meaning I ask them to walk as far as they can comfortably, and then keep note of two things. At what point do you start feeling tired? And that I call that T1 or time one. And at what point do you feel so tired you really can't go on any further? And you should keep note of T1, and that's when you should take your first break. And then after you've recovered, go again and keep going till you keep reaching that point of fatigue. And you see how far you can walk that way. What you'll notice after you do that for a while is that you'll be walking farther and farther until you reach that point of fatigue. So the idea is not how far can I walk, but how far can I walk before I start feeling fatigue. So what I see with too many of my MS patients is they walk and they're getting really tired and they're dragging their feet and losing their balance, you shouldn't be walking them. You should have already tried to take a recovery and then go. It's much better to recover and get more walking at a higher quality done than to just drag yourself through.
And before I go on to the next question, Elizabeth did put something in the Q&A. She said that she had tried intermittent speed walking inside, but the obstacles as far as uneven surfaces, people, cars make her tired quicker.
Um, well, I would have to ask Elizabeth, where does she live? I mean, if she, obviously, I don't want you doing intermittent speed walking, which is a good thing actually. In a really crowded place, you'd have to find a place where it's easier to do the walking. But perhaps it might be a better idea to just try to do intermittent walking, period, and forget about the speed. And once you've built up some distance, then maybe locate some areas where you have where it's safe to do the repetitious speed walking. We're doing a study on speed walking at Hunter right now, intermittent speed walking, and we're very, very careful to make sure that our subjects are in a very safe environment, because when you're walking fast, it's a little bit more of a risk. Your balance is a little bit more challenged, and you're going to get a little bit more tired. So it might be better to start with doing intermittent normal paced walking. And once you've gotten some comfort with that, then move up to faster walking.
She said she lives in Florida, by the way.
I understand that's a pretty big state. Are you in the suburbs? Are you in the city? Are you in the country?
We'll wait. And while we wait to hear back from her on that, I'll move on to James. He says, are there any suggested exercises to help with bilateral foot drop?
Oh, great question. So foot drop, for those who don't know, means that your toes on one or both feet, when you try to step, drag along the floor. And it's sometimes called toe drag or foot drag. And it's usually due to a combination of a couple of things: tightness in the calf muscles and weakness in the muscles in front of the calf, the muscles of the shin called the tibialis anterior. And it is actually, there's two really specific exercises I can recommend. And one is just called a calf stretch. And you may have seen it's sometimes called the runner's stretch. You put both hands on the wall, you put one foot behind the other, and you lean forward until you feel a pulling in the calf muscle. You hold that for 30 to 60 seconds, and then you go to the other foot. And you should feel a stretching in the calf muscle. Then, when you've done with that, you do what's called a toe raise in standing. You can do it in sitting, but standing is better. You keep your heel on the floor and try to lift the front of your foot up as high as you can, and then slowly lower it down. Now, one thing I want to tell you guys, I'm trying to do this thing with the MSF where I put together multiple sheets of exercise, uh, with each exercise having a specific goal. I don't know if it's been published yet. I hope it is. But if it hasn't been, I'm going to speak to Natalie Blake, who I believe is the director nowadays, to try and get it published in some way so that it's easily accessible. But foot drop is really common in MS. It's one of the most common findings I see. And I found with my patients, the first thing you need to do is stretch out the calf muscles. Most people with foot drop have really tight calf muscles, and you have to start stretching those out right away.
An anonymous attendee says, my legs feel heavy while walking. I am walking in cool weather, but what PT exercises do you recommend to improve this condition?
Well, when you say heavy, I'm not quite sure what you mean. Very often, when my patients have told me their legs feel heavy, it means they have a condition called spasticity. And if I could ask the asker of this question, do they know if they have spasticity in their legs?
They don't specify, but hopefully, like Elizabeth, they will elaborate in the Q&A.
So
Um,
if you have spasticity, it's something that your physician can treat you for. Um, if you do feel your legs getting heavy, I'm going to say once again, as soon as your legs feel heavy, stop. But rather than rest, stretch. Stretch your calf muscles, stretch your hamstrings, stretch your thigh muscles. Okay. The biggest mistake I see people with MS making who are trying to improve their walking is trying to walk through the fatigue, trying to overpower the fatigue, the tiredness, the heaviness. And instead of doing that, take a break and stretch your leg muscles out. The many, as a matter of fact, a patient I saw this morning, uh, she was having a sensation that her legs were getting heavy. So we just stopped. She lay down. I gave her legs a really long stretch. And after 2 or 3 minutes, she popped back up and we got back to work.
awesome.
So
There
resting and
is,
stretching.
I'm sorry. There is a stretching question from
Please.
Rose. Um, she says, how much stretching is too much? How long should you hold a stretch and how many times should you do each one? Is it
Uh,
okay to just do more? Is it okay to just stretch one time?
it's okay, but um, it's not ideal. So let me talk a little bit about stretching. I'm really glad we asked that question. Um, most people with MS are not stretching correctly, and this is something I spend a lot of time discussing with my patients. Consider you have a tight muscle, and the muscle is in a tightened position for most of the day. Say you do 2 minutes of stretching that muscle every day. That means you have 2 minutes a day where the muscle is stretched and 23 hours and 58 minutes when it isn't. That's not going to be enough. So it's useful to think of exercise like medicine. When you go to a physician and he prescribes medication for you, he's going to try and give you the right dosage of the medication and the right type of medication to get the best effect. Exercise is the same way. So the problem with stretching for a lot of people with MS is they don't do the right dosage and they may not do the right stretch. So what I recommend for my patients is to try and increase the amount of time they stretch, but to do it gentler. Okay? So many people with MS, they try to stretch and they'll try to stretch real hard. They'll do it for 20 or 30 seconds as hard as they can, and they'll say, oh, it hurt. That must mean it's good. Well, actually, no. A much better idea is to hold a very gentle stretch for several minutes at a time. Because what you're trying to do when you stretch is literally lengthen your muscle tissue. And a short, intense stretch is not going to accomplish that, but a prolonged, gentle stretch will. So think dosage. Think, how can I increase the amount of time that I'm stretching gently rather than doing it shorter and more intensively?
Nancy says, I was told MS patients have hip flexor issues. Is that the only muscle group highly affected?
Oh gosh, no. So any muscle in your body can be affected. Hip flexors are a common area. Um, and you can have hip flexor weakness and hip flexor tightness. The hip flexor weakness makes it hard for you to pick your leg up. The hip flexor tightness makes it hard for you to push your leg off when you're walking. Um, my finding is usually that there's more hip flexor tightness than weakness, although both are common. Um, the hip flexor tightness comes because people with MS often sit too much, and that makes the hip flexor very tight. So one of the easiest stretches to lengthen your hip flexor, there's two of them actually. One is just to lie on your stomach. Okay, that will stretch out your hip flexor. The other is to lie on your back, but let the leg that you want to stretch dangle over the side of the bed, and that will stretch the hip flexors out. So in my experience, although there is a lot of hip flexor weakness in persons with MS, there's much more hip flexor tightness. And my patients do much better if they try to stretch out their hip flexors than actually strengthen them.
Dorothy from Facebook asks, I have a gym membership and I don't know my limits or abilities as far as tolerance. Do you have any suggestions about where and how I should start exercising?
That's a great question. And I'm going to answer it in a couple of ways. The first thing is what are your goals for the exercise? And right now, I'd like to say there's really two different ways of looking at exercise for people with MS. One way of looking at it is MS for fitness, just to make your body fitter, weller, lose weight, healthier, etc. And that is a great goal for people with MS, partially because it's been shown in research that persons with MS who exercise consistently are going to have much less of a disease over their lifetime than those who do not. Literally, exercise is neuroprotective for people with MS. So that's real. So just exercising anyway is important. The other way, though, that you should think of exercise is something very specific. So, for example, we had somebody who spoke to us a few minutes ago that they have foot drop. Well, foot drop is a very specific problem having to do with tightness in the calf muscles and weakness in the dorsiflexor muscles. So if you work on upper body strengthening, you're going to get stronger, but it's not going to help your foot drop at all. So you have to think about what exercise do I need to address the problems the MS has caused for me. Okay? So if you're having specific problems, say with balance, you do balance exercises. If you're having specific problems with walking, you have to do walking exercises. If you're just looking at fitness, though, then there's really three pillars of a fitness program. There's aerobic conditioning, which is very important. There's resistance training, very important. And there's flexibility training. All of these are important. So my recommendation, without seeing you in person, of course, is to try and do a little bit of all three. Maybe every day that you go to the gym, spend a few minutes on each one. Okay? And start gently and see what your body can tolerate. Okay? What often happens is persons with MS will go to the gym, they'll work out like crazy, and then they'll be too tired to do anything for the next couple of days. That means you went too hard. So I would say go try a little bit of all three and try and stay relatively gentle. And if the next day you're not that tired, then you should go back and push yourself a tiny bit harder. But it's very important for persons with MS who want to start exercising to try to determine where their fatigue level is and to know that they should stop exercising right before that.
Ms. Coleman asks, how would you incorporate physical therapy if you're dealing with degenerative disc disease affecting your back?
That's a good question because that's not an uncommon finding. As a physical therapist, I really wouldn't want to know what's happening with the degenerative disc disease. If you're getting physical therapy for your back pain, you need to make sure that the physical therapist also knows that you have MS and you want to exercise with it. For my patients who do have back pain as well as MS, for all of them actually, the patient that the back pain has to be treated along with everything else. So we do for a lot of the patients, they might do a program which is focused on strengthening their core, might do a program on increasing the flexibility of their low back, certainly stretching their hips and their hamstrings, but it has to be part of your entire exercise program. You need to be able to to, as well as doing the exercises for strength, for flexibility, for endurance, you need to do some exercises to strengthen your low back.
Melissa asks, when I pedal on my new recumbent bike, my weaker leg will shake and vibrate a little bit of the time. Can I push through that and will it eventually stop shaking?
I really want to know, when you say shaking, is it like a tremor, or is it more like a jumping up and down?
She just says shake and vibrate a little bit.
Well, you see, now I would like to ask those in some detail, but try and get a little more information. But here's what I would like to say. First, make sure that the foot straps are firmly attached for your recumbent bike. Secondly, make sure that the seat is not too far away from the pedals. Okay, if the pedals are too far away from the seat, you're going to overstretch your leg, and that could certainly cause some tremoring or trembling. So
She says tremor.
yeah.
She put it in the chat, tremor.
Okay, so I would definitely say try and make sure the foot strap is on securely, and maybe move the pedals a little bit closer to the seat, or the seat a little bit closer to the pedals.
And we've got another question from Elizabeth. First of all, she's in the burbs somewhere in Florida, and she wants to know if you have any insight on the psionic neural sleeve.
A little bit. One of my patients just started using it. I would have to say right now that not enough research has been done that makes me able to comment on it strongly one way or another. The company seems to think it's really great. That's not a surprise, but I have not seen any compelling research for it for MS. For other diagnoses, it seems to be a little bit helpful. If it was me or somebody I loved, I would say give it a try, but I worry about people spending, my recollection is that it's quite expensive, and I don't want people spending a lot of money and then finding out it's not really useful for them.
Linda wants to know if you have any tips on having PT for vertigo.
Oh, I certainly do. So vertigo is a surprisingly common finding in MS, and the thing is, there can be many different types of vertigo that are associated with MS. There is a condition called BPPV, that stands for benign paroxysmal positional vertigo, that is slightly more common in MS than other people, but it can be treated very effectively by forgetting the name of the exercise, but how embarrassing. I'm going to remember the name in a minute. But you should go find a physical therapist or an ENT who specializes in vestibular disorders. And if you do have BPPV, it can be treated relatively quickly. One question I would ask right away is, do you have the dizziness if you lie down quickly or sit up really quickly? If that's the case, you probably have BPPV and could be treated pretty quickly.
Dr. Karpatkin, I don't know if you recall, but the anonymous attendee who told you they had been experiencing heaviness while walking, they said that they don't have spasticity, but just heaviness, and that they are just starting to walk when this happens.
I would recommend really stretching out before you walk. So what you're saying sounds like classic fatigue. So stretch your legs out, try to cool yourself off before you walk, and then If the distance that you can walk is even, just 1 or 2 minutes, then that's what you start with. And then you stop, stretch, recover, and do it again.
So Derek here has a two-part question. I'm
Good.
going to try to get through this in a minute. He says, do you see in your clinic that insurance will cover PT specifically for stretching? I've considered yoga options, but really need to be trained and reminded how to stretch ideally in a clinic by an expert. Does it need to be an MS trained DTP?
DPT. Ideally, yes, because I believe that MS is a really specific condition. It's different from other conditions, and you want to see the same way you'd want to see a physician who has specialist training in MS, you want to see a PT who has that as well. So try to make sure whoever you're working with has some MS experience. One thing that I do a lot, though, is I'm very comfortable with other PTs calling me and reviewing their patients with me and asking and getting my advice on how to treat them. So I'm happy to do that. Regarding insurance, it really depends on what insurance company you have. Some insurance companies are very happy to cover physical therapy training, others less so. In terms of getting the coverage, that's going to be dependent to an extent on how skillful the therapist is on conveying the information to the insurance company. Does the physical therapist can the physical therapist write the note for the insurance company so that the insurance company is more willing to cover the cost of therapy? Insurance companies, as I'm sure everybody here knows, they make money when they deny treatment, not when they provide treatment. So they have a vested interest in your not getting therapy. So you have to make sure that the therapist is very willing to do battle for you, because the insurance company would much rather they don't pay for anything than they do. So
That's a sad truth. Thank
it
you
is.
for sharing that.
Well, I've been in the field over 30 years, and it's only gotten worse. The insurance companies are in the business of are not in the business of helping patients. They're in the business of making a profit for their shareholders, and they do that by collecting premiums and not paying for services.
Phew. Caroline asks, should you stretch before and after walking?
Before, after, and during. It's pretty hard to stretch too much. When you stretch too much, it usually is people stretch too hard. So I would say stretch before, take a break in the middle of the walk, stretch again, take a couple breaks and stretch, and then stretch when you're done.
Margie wants to know if you have any recommendations for workouts specifically for people with MS.
Well, somebody already really asked that question, and again, I'll repeat the answer. It depends on what you're after. If you're looking for generalized fitness, then you have to hit the 3 pillars of strength, flexibility, and aerobic training or endurance training. But if you have a specific problem, please. If you have a specific problem you need the therapy for, like you're having trouble with balance or trouble rolling over in bed or trouble using your hands, you have to get therapy specific for that. So there's no one best exercise. MS is incredibly individualistic. I must have seen tens of thousands of MS patients over my career. I can honestly say I've never seen 2 who are the same. So each person is going to need a different, individually tailored exercise and physical therapy program. I like to say I have to invent a new physical therapy for every patient I see, because everybody's going to come to me with very specific, individualized problems.
Yeah, I'm not entirely sure if Margie was here when you answered the question earlier, but if she was not, I'll apologize on her behalf. Ms. Coleman has another question. She asks, can you have both hip flexor weakness and tightness at the same time?
Sure. Absolutely. A weak muscle is usually a tight muscle. A tight muscle is usually a weak muscle. So if your hip flexors are tight, that means they can't move through their full range of motion. That means they don't have strength throughout the range of motion. But what many of my patients often find is once they stretch their muscles out enough, they get much stronger because you've restored the range of motion so you can put strength through that entire range. So very often when a patient comes to see me, they're both weak and tight in the same areas, and I'll usually work on treating the tightness first, because once they get the flexibility back, their muscles function with more uh, efficiency, and they'll feel much stronger as a result.
Another anonymous attendee says, I have lower back and hip pain. Just walking causes pain. Is there anything I can do to help with that so I can do more walking?
Well, it's hard for me to answer that because I need to know what's causing your low back and hip pain. Um, in my experience as a PT, low back and hip pain is A, relatively common in MS, and B, quite treatable. But you have to find somebody who is willing to, who can help you with that pain. So I recommend you're trying to find a therapist who specializes in low back and hip pain and uh, and can treat you for it. My In the majority of the patients who've had low back and hip pain with MS who I've seen, it usually is due to poor posture, weakness, um, and inactivity. Uh, so too much sitting. Um, there's often a lot of weight gain that's associated with MS because people become less active. So the patients of mine who recover from the low back and hip pain that they have usually do a number of things. First, they get an exercise program to treat the low back and hip pain, and they find a specialist in low back and hip pain to treat them. And then they try to change their lifestyle so that they avoid the activities and the postures and the positions that have led to the low back and hip pain.
Dr. Karpatkin, I am going to ask if you could open up your Q&A window to address the next question from an anonymous attendee. I don't know if this is a typo or what, but if it isn't, I need your professional eyes to tell me what it is I'm reading. So this person asks thoughts on using myoball to release something that appears to be radiation, but I don't know what that is.
Yeah, the psoas is the hip flexor. The anonymous attendee knows their anatomy pretty well. So congratulations for that. So if your hip flexors are really tight and they've been tight for a long time, a myoball is just a brand name for a hard rubber or rubber-like ball that somebody will lie down onto and roll over the muscle. And some people find that really relaxes the muscle. Some people just find it uncomfortable. Some of my patients find it really useful, some don't. Uh, Personally, I prefer just stretching the muscle out using some of the stretches I talked about before. But I will say that many of my patients have used that sort of release ball or myofascial ball and gotten good results with it. I've tried it myself. I just think it hurts, but um, uh, but it has been found to be helpful more for athletes than people with MS because they tend to have more muscle spasm. But there's no reason not to try it. I would suggest that trying it along with stretching and moving as well is probably a good idea. By itself, it's probably not enough.
So we have two questions about the vibration plate, one
Sure.
from Facebook and the other from another anonymous attendee. They basically just want to find out what your opinion is on the machine and if it's good to use.
Sure. I would like to say that it's really effective. My experience with it has been pretty mixed, though. I found some people it's really helped. It's if they had muscle spasms, it quiets it down, it makes them more relaxed. I found some people it's had the opposite effect on them. It led to more fatigue. So um, when patients are interested, I say try it, see if it helps. But MS is so widely variable that I know it's going to help some people and not help others. I always get asked a lot at events such as this, what's the best exercise for MS? And that's not an answerable question because everybody's MS is different, sometimes profoundly different. So if you want to try the vibration platform, vibration plate, you should. The research on it has been very mixed. It's helped some people, it's not helped others, and it's hurt others. When I had one in my practice, some people just loved it, and some people, within 2 or 3 minutes, they really couldn't stand it anymore. So,
So
give it
Jan,
some.
I'm sorry.
No, go ahead, please.
Jan says my PT says that we have to have a goal. I am wheelchair bound and have trouble stretching myself. Is PT for stretching covered by Medicare?
Ideally, yes, but it can't be stretching by itself is not a goal, but saying something like stretching to improve transfers, stretching to improve bed mobility, stretching to decrease the risk of complications, stretching to decrease pain, stretching to increase comfort. Those are goals that I've used in the past. But stretching by itself, no. Or the PT is to find a way that how the tightness of your muscles is contributing to other problems. And therefore, you could say that by stretching this muscle out, we are solving this problem, and the goal is to solve this problem. So in a lot of the notes that I've written, I will say the patient is having difficulty transferring because of tightness in their hamstrings and their calf muscles. Therefore, the plan of care is going to include stretching these muscles out so the patient can be more independent in transfers.
Carolyn asks, do you recommend bands or weights for strength training?
Yes and yes. The problem with a band is that at the the bands, the more you stretch them, the harder it gets. So you don't get equal resistance through the range of motion. So at the very beginning of stretching out a band, the resistance is going to be pretty mild. At the end, it's going to be a little bit harder. The weight, on the other hand, is going to be the same resistance all the way through. The other thing is with bands, they tend to stretch out over time and break, so they're a little bit inconsistent. The advantage of them is they're tiny and you can take them anywhere you want. So for most of my patients, they usually do have some combination of bands that they use, but I have to replace them fairly frequently.
Joanne says, my MS has progressed to secondary progressive and I now struggle to walk. I use a cane inside and a rollator outside the house. I stagger, swing my left leg, have foot drop, weak or tight hip flexors, etc. I feel like everything is off and I wonder what I should work on first. Also, thank you for taking the time to answer our questions. Greatly appreciated.
Well, I thank you for coming to this. You told me a lot of information. The first thing I want to say is don't stop walking. Okay, once you stop, it's hard to go back. It's a bit of a one-way street. The second is I want to know if you're with a physical therapist or not who's helping you with the walking. If you're struggling through with a cane and a walker, I need to know why you need the cane or walker. Is it weakness, tightness, loss of balance, etc.? But if you're not seeing a physical therapist who specializes in multiple sclerosis, I urge you very strongly to do that because in my experience, people with MS who have difficulty walking can improve their walking if they go to a therapist with the right training. So try to keep walking and try to find a therapist with MS experience who can give you walking related exercises.
So we have two questions. I'm guessing they're just asking your opinion again. One from James. He just says Epley maneuver, and Elizabeth says Brani's maneuver. No
Epley maneuver, right. That was the word I couldn't come up with before for BPPV. The vertigo that people with MS often feel with BPPV, BPPV stands for benign paroxysmal positional vertigo, is treated with something called the Epley maneuver. So his memory was clearly better than mine. And what was the other name?
Brani's.
Yeah, the Barani technique. That's another maneuver for that are used by people with vertigo. The Epley is what I use pretty often, and I teach my patients how to treat themselves with it. But not all vertigo in MS can be treated with the Epley maneuver. Sometimes you have to go to something called vestibular rehabilitation. Okay? And it is a specialty for persons with, that physical therapists can learn, and it is often a specialty that MS therapists have to learn. So I would say a good 20 to 25% of all of my MS patients have some type of vertigo or vertiginous problem, and sometimes it can be treated with the Epley, sometimes it needs full-blown vestibular rehabilitation.
And I have a question from Nancy. She says, have you worked with a lateral elliptical training machine?
Yes, I have. The elliptical trainer has pluses and minuses. The pluses is that it's allows for a fairly intense aerobic exercise in a much safer environment than say than walking on a treadmill. And it makes you work a little bit harder than being on a bike. So I like that. The drawback is it doesn't really carry over into walking. So many of my patients who've used elliptical trainers, they'll get much fitter as a result. They really like it because they can push themselves. Their legs get stronger. Their cardiovascular health improves, but it doesn't carry over that much into their walking. They get better at doing the elliptical trainer. They lose weight. Their heart rate gets better, but their walking does not improve that much. So generally, I encourage to do it, but I will say it is not that likely it's going to improve your walking that much.
Linda has a comment, not necessarily a question, but she
Okay.
said vertigo is mostly when I roll over at night or when I sit up. Balance feels off for maybe an hour or two in the morning.
So it sounds very much like you have BPPV. It sounds like you would be helped by someone who could teach you the Epley maneuver or do it for you. And I urge you to find someone who could do that. The balance that feels off first thing in the morning may be something that is separate from the BPPV, but balance training, it's one of the most common things I do for my MS patients is give them balance training. And balance can improve with training. It's what I do all day long. So finding a PT who does have some training in how to improve balance would be a good idea. But what you also described, the dizziness when you roll over in bed, the dizziness when you sit up, that sounds almost exactly like BPPV, and it can be successfully treated with the Epley maneuver.
So we've got a question from Terry on Facebook. She asks, I work out on a recumbent bike. Is it better to go low minutes and high level or higher minutes and low level?
The answer to that question is yes. You should do some of both. So probably the best thing you could do is once or twice a week, do high intensity interval training where you'll bike really hard for 20 or 30 seconds and then relax and then bike really gently for 1 to 2 minutes. And then 1 to 2 days a week, bike at a relatively comfortable, moderate pace continuously for 10 or 15 or 20 minutes. But it's good to try to get your heart rate up.
Mhm. Rose says, I heard that stretching too much can make you tighter. So now I'm afraid of doing too much.
You can make yourself tighter with stretching too much. If you stretch too hard, what will happen is your muscle will have what's called a reflex spasm, and it'll make your muscle actually shorten. And this is why I tell people to stretch gently for prolonged periods of time. If you do it that way, you will not get tighter. But if you do short, intense, hard stretches, there is a risk that your muscles will spasm and your muscles will feel tighter. Absolutely correct.
Nancy wants to know if you can talk about neck and shoulder issues in multiple sclerosis.
Sure. Neck and shoulder injury complications are not uncommon in MS. Probably the most common neck issue I find is because the person sits too much or sits at a desk too much. They get a very forward head. Okay? And it has to do with the posture of their spine. So right now, most of you who are listening are probably sitting kind of leaned forward over your desk. I can see that Kimani is not, but I think the rest of you probably are. So I'm going to ask you right now to all try to sit up a little bit straighter. Try and get your head more evenly over your shoulders and try and pinch your shoulder blades together. That's one of the easiest exercises you could do to help your neck, a postural exercise. For your shoulders, their shoulder is a very complicated joint. It has about 5 or 6 different joints that comprise it, and there's a lot that can go wrong. But what I found is, again, very often the forward head position is what leads to a lot of the shoulder pain. So very often when a patient of mine does have shoulder pain, I tell them to try to fix their neck posture, pull their shoulders back, pinch their shoulder blades together, and see if that results in a decrease in their shoulder pain. Very often it does.
Anna has a comment and a question. So she says, can you speak about knee hyperflexion? She had a brace for a few months and she's been trying to make it work. Her PT suggests that she should wear it, but she needs to focus on bending her knee when she lands or steps on that foot. She says this requires her quads to work more than usual, and she's trying to build up her strength and stamina. So
Do you mean hyperflexion or hyperextension?
she said hyperflexion.
Okay, well, I want to ask her again. The hyperflexion means your knee bends too much, which is actually very uncommon, unless you mean that the knee is collapsing. Okay, so I need you to answer the question, is the knee collapsing during gait or is it popping backwards when you walk?
I'll wait for her. She says popping back.
Okay, so that's hyperextension. Okay, not collapsing. So if I could examine her right now, I bet I would find that she's a foot drop on or a really tight ankle plantarflexure on the side that the knee is popping backwards. So in addition to trying to contract the quads, as you were saying before, I would strongly recommend working as hard as you can to stretch out your plantar flexors. And trying when you're taking a step and your foot hits the ground, make sure you land on your heel, okay, instead of on your toes. That will keep the leg from popping backwards.
And she says foot drop and hip flexors are problematic too.
Yeah, I would say one of the best things you could do to keep the knee from snapping back is to really try to stretch out that calf muscle.
Mrs. Coleman has another question. She says, how hard is it to find a multiple sclerosis physical therapist?
That is a really good question. So there's a couple things you can do. First, you can go to the American Physical Therapy Association website That's apta.org. And there is a service you can do. It's free to the public called Find a PT. And it asks you to put in your location or your zip code. And then there's drop-down boxes to say, what are you interested in working? What are you looking for? Is there a specialty? And you should look for a therapist who specializes in neurologic physical therapy. And they will help you find people. That website will help you connect with people who are nearby you, who have the relevant expertise.
Melissa wants to know what kind of exercises can someone with balance issues do?
It's going to depend on in what way your balance is affected. So when I see a new patient, I give them a balance test that's called the Berg balance test. And in that test, I have the person try different positions, standing with their eyes closed, standing with their feet together, standing heel to toe, standing on one leg, turning all the way around in a circle, looking over their shoulder. And I look to see what tasks they have trouble performing. And if they have trouble, say, balancing with their feet close together and their eyes closed, then that's what I have them practice. Very often balance is lost in MS because the person stops challenging their balance. Their balance gets worse, so they stop getting into positions that challenge their balance. As a result, their balance gets even worse, so they practice it less, which makes their balance worse, etc. So it becomes a bit of a vicious circle. What I do is I urge my MS patients as much as they can to try to get into positions that challenge their balance. And that might be for some people, just standing with their feet together. It might be for some people just standing with their eyes closed. It might be for some people standing with one foot in front of the other. It might be for some people shifting their weight forward and backward. But for your balance to get better, you have to practice your balance. One thing that a lot of people do is they try standing on an unstable surface, like on a foam pad. Okay? So finding things that challenge your balance is one of the best ways to get your balance better. Also, of course, finding a physical therapist who specializes in balance training.
Lori asks what your thoughts are on the tau patches, TAO.
I do not know what those are.
Neither. Elaborate, Lori, if you could. Meanwhile, we'll move on to another question from Terry from Facebook.
I'm just going to quickly look up tau patches. Hold on.
Okay. Sorry about that.
All right. I'm curious. Tau patches. It's an so it looks like a wearable nanotechnology device, combines acupuncture with light therapy. I am not aware of any research on it. I know some of my patients say that acupuncture is very helpful to them. I recently published a study looking at acupuncture in persons with MS, and unfortunately, I didn't see that acupuncture really offered anything. It was just one study, so I don't know any. So maybe other studies will show more. Again, many of my patients say that acupuncture is really helpful to them, but as far as I'm concerned, the evidence is not there.
So Terry from Facebook, first of all, she thanks you for answering her question from earlier. She says that I use a walker and go backwards, and my left knee, just on the weaker side, locks and doesn't bend. Is there a good exercise to help this?
I need to know how exactly it locks. Taking a wild shot in the dark, I'd say probably the first thing you should try to do is stretch out your calf muscles. I know I've said that a lot already, but usually when there's that hyperextension, that knee locking, the thing that's leading to it is the tightness of the calf muscles on that side. So I think one of the best things you could do is try to stretch that muscle out.
She's tuning in from Facebook, so I don't know if she is commenting. Bavia, do you see anything more from her?
No, I don't.
No? Okay.
If she does respond in the next 2-3 minutes, I will definitely let you guys know.
Right now, we've actually gotten through all of the questions. We've answered over 50 between Zoom and Facebook, our attendees from there. So I think this has been amazing, this information.
So let me ask you guys one favor. If anybody wants to contact me directly, my email is herbcarppt@gmail.com. And I'm very happy to have people reach out to me. Or if you want your PT to reach out to me, I do a lot of training of PTs. I'm really happy to do that. And you know, one of the things my experience has shown me is physical therapy can be tremendously helpful to people with MS. It's just underutilized. And that's for many reasons, but this is why I try to give as many talks like this as I can. And I believe I'm giving another one in not next month, but the month after. So if you have more questions then, I'll be here for you.
Yes, definitely. Bavia, can you type in Dr. Karpatkin's email address? I can't send it to everybody from what I see in chat for some reason.
Yeah, I'll do that right now.
Awesome. So everybody just sit tight and wait for Bavia to type in his email address. Meanwhile, I think we will close out here right at the hour mark. So if you did miss any part of this conference, if you head over to the Multiple Sclerosis Foundation YouTube, I'm sorry, not the YouTube channel, the Facebook page, we are live streaming from there. And once we close out the Zoom here, it will be available to view immediately afterward. Meanwhile, this recording will also be available on the Multiple Sclerosis Foundation YouTube channel very soon. Please follow MS Focus on Facebook, Twitter, and Instagram for times and access information. And also, if you are on Zoom and you're watching after we close out here, if you wouldn't mind just filling out that survey, just to tell us how we did. And if there's anything that you would like us to cover in future presentations, we would be happy to hear your requests and recommendations. Our next conference will be this Thursday, February 2nd, which I think is Groundhog Day at 3:30 p.m. Eastern Time with Zoe Edwards, who will be talking about healthy eating. Can't have enough of that, right? So our sincere thanks to everybody who attended, and thank you guys so much for all your questions. What's more, thank you, Dr. Karpatkin, for answering all the questions. I hope that you have a great rest of your day and everybody stay safe.
Okay. Take care, everybody, and I'll see you in a few months.